Good afternoon, everyone. Welcome to today's Community Mental Health Transformation webinar. Today we're going to be looking at developing an integrated model for neighbourhood mental health and wellbeing teams. But before we do that, I'd just like to introduce myself. I'm Perce Williams. I'm the Communications Officer at Sussex Partnership. I work with Megan, who usually does these webinars, so I'm just kind of like filling in today. But thank you for joining us and welcome to the webinar. Our presenters today are Penny Fenton, Community Pathway Lead, and Martin Dominy, VCSE Mental Health Transformation Lead. But before we actually start with the webinar itself, there's just a few housekeeping things that we need to go through. So this webinar is being recorded today, and the webinar is in a slightly different format. We've trialling it out at the moment, holding it as a meeting so that people can be more involved. So you can have your cameras on, or if you prefer to turn your cameras off and anonymise your name, that's completely fine. Please do whatever is most comfortable to you. There is an option to turn on live captions. If you see at the bottom of your screen, there are 3 dots in the right-hand corner. If you click on there, you can enable captions. So please do that if that's helpful to you. There'll be 15 minutes for questions and answers at the end of the session. So please think about any questions that you want to ask and put them in the chat box. The presentation itself will be around 25 to 30 minutes, and then we'll have 15 minutes at the end for questions. There'll be a summary of the topics covered in the webinar that we'll email out to everybody that's come along at the end, just so you can have a bit of a summary of everything that we've covered, and there'll also be a recording of the webinar in case you want to watch it back. We'll also send you a short survey. This is just so we can get a little bit of feedback about how the webinar is going and if there's anything we need to do differently. So please, just take the time and just tell us how things are for you. You can also watch back all of our webinars that we've held so far. You can do that by scanning the QR code that's on the screen, and we'll also include that in the summary that we send out in the email after the webinar. So I'd like to introduce Penny Fenton, Community Pathway Lead, and Martin Dominy, VCSE Mental Health Transformation Lead from East Sussex and Brighton and Hove. So Penny and Martin, over to you.
Thank you. I'm Penny Fenton. I'm the Community Pathway Lead. Well, I work for Sussex Partnership Trust, but I work across the whole system on community transformation. So in equal partnership with colleagues from voluntary sector, primary care networks, local authorities, etc., and in partnership with expert by experience and expert by experience leads, and work very closely with my colleague Martin Dominy.
Right, thanks, Penny. So as Penny mentioned, I'm kind of the VCSE lead. I kind of represent East Sussex and Brighton and Hove, but working very closely with Penny and other colleagues around the kind of transformation and the model design as well. Kind of worked in Sussex for about 15 years now. Is it okay if we just ask if everybody could check they're on mute? I'm just getting a bit of background noise, if that's okay. Thank you, everybody. So appreciate that some of you have kind of joined these webinars very regularly. So some of this you have seen before, but we also just wanted to make sure that everybody kind of had an opportunity if you're new or joining the program kind of later, just to have a bit of background context setting. So this is initially a 2-year program around kind of mental health transformation across the whole of the country. So Sussex has held some very kind of key kind of workshops, place-based, also kind of system-wide, kind of developed some kind of key kind of structures and foundations about what the transformation program will be kind of built upon. So again, you may have seen this before, but there's kind of 4 very kind of key principles that we work to as well, about personalization and complete care, kind of having more of a holistic and sort of tailored support for people, making it simple and seamless. Constant feedback from people, it's very difficult to navigate. It's kind of, you have to be referred into different parts of the system. We're actually kind of trying to make sure that we have kind of one system is that people to kind of really understand it's very clear about how they kind of access that kind of support really, and there's no kind of, you know, being passed to kind of from service to service as well. It's all joined up, making it is accessible for everybody and very inclusive, you know, from people from different communities, different health inequalities as well, and really kind of local and based. And overarching all that is a very kind of strong determination to be experienced from people kind of accessing support, that they experience it as one service. So we work very closely together, whether that's kind of, you know, within the VCSE community, but make sure that the VCSE works very closely with the statutory services as well. So we're really come together and we join kind of, you know, a real kind of informal but really kind of positive relationships around working together. So what some of the work that we've done as already is setting our vision. We purposely kind of gone for a very non-technical vision for kind of the mental health across Sussex. So it's to increase the understanding of mental health and wellbeing in our communities, to make it easier, quicker for people to access support when they need it, and close to home as well. So the idea of this, that we can explain what we're all trying to do collectively, but we can get up today and kind of walk out into the street, talk to somebody about our vision, and then it's really, really clear and really understandable. So we're not going for any kind of technical language as well, to make it, you know, really simple. Next slide, please. So we've been working hard over the last few months around developing this new way of working, this new integrated model. And so that we're kind of, the aim of the model is clearly show that kind of the community mental health services kind of post kind of transformation, and how they aligned better, how they work together much more closely as well. So we've been asked to kind of be very kind of clear visually, kind of there was kind of people have been often asking us to kind of have a kind of very clear diagram, which we're kind of working towards, but we appreciate that no one diagram says it all. So we kind of want to make sure that we're kind of just going through those stages of the day, and we kind of see today as a very important part of that consultation as well. So there's a smaller integrated working group that has people from the Sussex Partnership Trust as the kind of the statutory, the biggest provider, obviously, but then kind of there's representatives across Sussex of the VCSE, local authority, and then people with lived experience as well. So possibility, people's kind of leading that, kind of making sure that everybody is kind of working really closely in that kind of co-production as well. Thanks. Next slide. So in developing the model, today we're going to kind of just sort of demonstrate what we've got in terms of a sort of circular approach, really, but we really kind of want to make sure that kind of the message comes from that it's around kind of, we're building the services around people, and it goes back to one of our principles about personalised care as well. And we kind of just want to kind of go through about how people were likely to come in touch with services as well. So it's kind of, you know, that earlier getting advice, getting help, getting more help, and then people that kind of need that kind of urgent and kind of crisis support as well. So the final version, obviously we're kind of, as I've said before, we're kind of working towards the final version as well, but we're kind of quite comfortable with that today, because Penny's going to kind of start to walk through the model in more detail in a minute. But we didn't want to kind of bring today kind of a finalized, finished kind of diagram or an explanation of the service, because we really kind of just didn't feel like that was really a meaningful consultation. So this today is actually kind of just like Penny to run kind of through that, and then for us to kind of ask questions, have a conversation, take your feedback, take any concerns you have, and kind of work on the next kind of the iteration of the model as well. So yeah, so this is a real kind of, we really kind of want your kind of questions and your feedback and your engagement today. Thanks. I think I'm handing over to you now, Penny, is that correct?
Yes, thank you. If we can have the next slide, please. So this is the first iteration of well, it's not the first, it's probably about the 6th, 7th or 8th by now, iteration of where we started to try and demonstrate and discuss the approach in a diagrammatic way. Obviously, lots and lots of information will need to sit behind this, but the purpose of this was to say, does this really explain what we're doing? Would people really understand it? Is it something that we could talk to, that we really wanted to speak with you about today? But also just to reinforce, we're not starting from nowhere. It's not today and then we'll build the model on it. There's been work going on in the background. Colleagues on the call may well have been involved in a lot of that work, and there've already been a series of things that we've managed to establish, and colleagues have worked very hard to establish in sometimes tricky times in terms of recruitment and all of those things. And we've really been able to do that by working together as a collective, so bringing together that multi-agency approach and really building really trusting relationships, so we've got truly equal partnership to be able to approach and develop our services together, and really working together from the beginning in a co-produced way, both with all of the organisations and fundamentally with people that use services, their families and experts by experience. So before I talk about the model, some of the things that we've achieved, colleagues have achieved, so I'm talking on their behalf, certainly not on mine, is we've now got additional services in 27 out of our 39 primary care networks. So that's a partnership between Sussex Partnership Trust and voluntary sector organisations providing mental health support directly into GP practices. And we really hope to be able to expand that to the rest of our primary care networks. And there are 39 of those across the system. For anyone that doesn't know, a primary care network is a collection of GPs working together to serve a local population. So it's really about starting to expand that front door. We started within Sussex Partnership Trust thinking about how our own internal services may need to come together more closely to be able to then work more closely with the rest of the system. And that work is early days, but very exciting. There's been investment in eating disorders, and in East Sussex, they've seen a reduction in wait times around eating disorders. West Sussex had some investment 2 years ago now, and now have 2 community rehab hubs up and running, which is really exciting. And we've really started to do a lot of work around things like triage work. Each area has a plan around how they might think about understanding each other's capacity and demand and understanding each other's offer, and how we help people when they come into a system and ask for help, not have to be referred back in, to come back out, to go back in, etc., etc., etc. And yesterday we had our first cross Sussex triage workshop to really think about some standardisation. So that's a piece of work that's ongoing, and we're working really closely with digital, and we've seen the delivery of something called Plexus, which has started to allow us to share some information and to start think about our digital offer. And some people would have been involved in the work that digital have led around Mind District, which has offered some clinical outward facing work through a digital platform. That platform's going to change now, but progress will hopefully continue to be made. So just really to set the scene, we're not starting from zero. Each area has a place-based group that's really thinking about this stuff. But this is really to make sure we're bringing it out into a much broader circle and to really help us move on to the next phase and the next stages. So I'll talk a little bit about the diagram now. As Martin said, the circles were really to say there's a series of stages, I guess. But one of the bits of feedback we've had already is that it's not linear. So people don't always go from getting advice to getting help to getting more help, and people can pop up anywhere in this circle. And that's a really good point that we'll need to add in and make sure that we can demonstrate through the diagram. But fundamentally, we wanted to describe to people our ambition, which was the centre piece of writing, working together as one team to provide a bespoke package of support that is tailored to your needs. So we can really have that person in the centre. And in terms of the diagram, there might be people in the middle of there could be other bits of dialogue, but this was our kind of starter for 10. So the first bit, the outside circle, the getting advice circle, purposely made bigger because we know most of our population will stop at that pathway, if you like. So when people start to think about mental health needs and might have start early concerns, how can we best give really, really good advice and guidance right at the beginning of someone's journey? And areas we're thinking about in there are things like social prescribers and how we really work with them to develop their mental health offer, various community wellbeing hubs that are already developed by other services across the county. Can we develop a single point of information that's around a digital point of information? And how can we make sure we've got really good self-help support and guidance out in generic universal services? So if you work for Gatwick Airport and you might start to think about your mental health needs, that we're really supporting big employers, for example, in really being able to make sure that you have, or they have, that sort of information. So that's a big ongoing piece of work, and Well, obviously, we've got lots of partners in terms of local authorities and public health, because that's absolutely their domain as well. So that's a really developing picture. And we've had lots of areas of success and work that we can talk through in more detail as we progress. Then the next part of the ring, which describes here as getting help. So that bit where you're beyond, people don't want to just necessarily hear about it or have a workshop sheet or do some digital work or get some advice from a person on the phone. This is more around, what do we need to start to access to get that support? So NHS talking therapies, and people might have heard of it being referred to as IAPT in the past. It's just changed its name. That's specifically there for anxiety and depression, and that will remain so. People can self-refer to that as well as being referred into NHS talking therapies. So that's one of the services. Other universal services that are out and about. So there are family centres out in communities. There are all sorts of places that already have some of this information. And there are a whole big, huge variety of voluntary sector organisations. And in some areas of the county, West Sussex to note in particular, the Pathfinder service has fully formed, in that if somebody contacts any of the partners, they're able to reach the other partners very easily. And East Sussex and Brighton and Hove are very quickly developing ways of working in a similar way. So if people walk into any voluntary sector organisation, they're able to be linked into another, should that not be the place that might well best meet their needs. The getting more help, as you can see there, that'll be for the fewest amount of people, and it is now. So that the figures would support that absolutely. Is we've got at the moment, we call it assessment and treatment services. We've got crisis services and links with things like inpatient beds, and it's really making sure that that getting more help ring, the resources that we have in there are much better described, because at the moment we have some fantastic work going on in all of those services. There's also some work going on in those services that perhaps needs would be better met at a different part of the pathway. So, for example, when we've got people who are ready to move on from treatment, if you like, from assessment and treatment services, the time and energy that requires for both the person and the worker to get into the right bit of system for longer term support can be really quite challenging with the pressures on services. So how can we do that better? How can we make sure we've got teams really working together throughout the whole pathway to be able to have those conversations about how do we help someone get help that they want that isn't where they are at the moment? So perhaps something like a system navigator role we've talked about, or a key worker role that really smooths that navigation for people between the system, so they don't feel like they've got lost and they don't feel like they have to go back to their GP and back into services, for example. So that's how it describes. That's how we describe it as a whole model. And if I could have the next slide, please. This next bit really is breaking down the three rings. So this is the definition, as you can see in the middle, around easy access to information. That's about information, advice, signposting to local support should people want it. And you can see in the outside ring, we've just started to populate where that might be and how that might happen. But we were just talking on a prior call about how do we get all this information on a digital platform as well as out in communities. And that's something that's being worked on across many services. So local authority services, you might hear some discussion about something called integrated teams, which are much more about physical health teams, but we're thinking about how do we join and have partnership with those. So we're not so everybody isn't creating a website, so to speak, and we're trying to find a way of it being easy. So if you have a health and care need in Sussex, the end dream would be you'd be able to click on it. There'd be a mental health section, there might be a debt section, there might be a housing section, and you're able to kind of go to those spaces. But we're not there yet. But we're starting to understand what might be required, and that will definitely be really exciting, particularly as digital platforms develop, and also at that easy access to information, some really early advice. So what can we have digitally, particularly around sleep and around managing thoughts or managing emotions? It's very low key that people can actively use in a self-help way. So if I could have the next slide, please. And this is the next bit, the kind of getting help bit. So some parts of our system you can self-refer to already. So we talked about NHS. I talked about NHS talking therapies before. That can already happen. So there can be a direct route in and out of those services. And while people really appreciate that, the bit where it was less joined up, which is again the bit that we're really working hard to address, is if somebody's in that talking therapy as part of the pathway, how else do they link to the other bits of pathway for either other bits of their needs, or if they need to kind of move across or wherever they need to move to at a particular moment in time. So there's a lot of work about how do we start to build multi-agency discussions, how do we start to build multi-agency triage where we come together and are able to say, oh look, you know, I've been working with Penny, but actually we've had a discussion and it feels like this person might need this. We don't offer it in our bit, but I don't want to have to refer this person back to their GP to get to the piece of the pathway they need. And they're in development now, and you'll hear them described as perhaps neighbourhood teams in the future. So how we really understand a neighbourhood, and that might be 3 or 4 primary care networks population together, and thinking about, okay, what have we got in Eastbourne, for example, or what have we got in Ada, Arran and Worthing, or what have we got in Crawley, that's a whole system that can come together so we can really determine who we need to have around that table to be able to have those discussions to help people move in and out. And so in the future, we might see people being referred to mental health services in an area, for example, or hopefully at some point self-referring, but they'll be referred to a system as opposed to a very single organisation as it is now, because that's a lot of the feedback we've had from people that use our services. They don't necessarily want to see lots of new services. They just want to be able to get the help they need through the plethora of services that we luckily have available in Sussex coming together more effectively. Go for the next slide, please. And this bit is around getting more help. So really specialist services, offering really specialist help and support. And that might be crisis intervention services, that might be very specific specialist psychological interventions that ATSs offer. The real clinical element of people when they're perhaps feeling at their most vulnerable or feeling like they're at the most risk and feeling like they need some support around perhaps safety planning, perhaps managing those really difficult and stressful times that people may have over periods of time in their lives, and really being able to get that quickly. And just to reinforce, you don't need to start with getting advice to getting more help. The idea really is wherever somebody happens to present or be, that assessment can be made really quickly and the access can be made into any parts of the circles, so to speak. So if somebody is in absolute really difficult situation and needs some more immediate help, even if they don't land directly into that referral route, there'll be a way of overcoming those barriers to get to that right point as quickly as we possibly can. And of course, this is all work in progress. And again, we've got some areas, I mentioned Pathfinder before because it was established before transformation, are able to access all different points of the pathway, from voluntary sector providers to some clinical support to crisis teams. And that's the kind of model we're really hoping and are ambitious for around the county, so we can really support people to do those things. And really to mention that this won't meet every need that isn't met at the moment, but it will help us really identify any gaps as well. So we really hope everyone gets something, and if it isn't the ideal something, we can understand what those gaps are. So for example, yesterday we were working with the eating disorders programme, and they were talking about what they had at an early help stage for people that might start to experience disordered eating rather than formal eating disorders. And we were talking about, is there something like a 5 ways to wellbeing group we could set up that is around that particular topic? So we start to really move those pathways to the front door. And that's really just a reminder of the 3 specific pathways we've been asked to look at as part of the transformation programme have been eating disorders, complex emotional needs, and community rehab. So really the psychosis part of the pathway. And the reason for that is then to tie this into the NHS talking therapies around anxiety and depression. So although we've got all of those domains, it just means we need to pull them all together as well as a single offer. So we don't want more services developing in silos, but to make sure we are targeting those specific pathways as well as the more generic pathways for people. So I can have the next slide, please. So it's a lot to absorb, and it'll be really interesting to get to conversations and questions shortly on this, but just to say there is the email there is a short survey. We're really keen to hear people's views, people's thoughts. If we were to take a model like this out to your group or wherever you're from, because hopefully there's a breadth of people on this call, would it work? Would we be able to really easily describe the model? What else would you need? Is there any bit you think, oh my goodness, that's really not clear, or we need to add things? It's all really, really welcome information, because what we really hope to do is then send this out to a designer who's really skilled in terms of representing these types of diagrammatic pieces of information alongside some written information, so we can have a bit of a standardized slide pack for people to be able to really start to understand and talk things through. And by no means is everything done. And as Martin said earlier, that's absolutely right, because the final details of delivery really need to be around local areas and people getting together in a multi-agency, a multidisciplinary way in localities and really working these things through. So it will be an iterative process. So we really need to start with getting everyone together and setting those scenes, which is starting to happen, and then moving into priority areas, things like, you know, how can we really work well on multi-agency triage, etc. So that's where we are. Could I have the next slide, please, Pez? I think I'm handing over to Martin at this point. So I'm going to hand over to Martin just to really and we can take some questions and have a little bit of a conversation about how that's felt, bearing in mind it's a lot of information that we've shared today, and that will go out in the slide pack. So please don't worry if it's too much to digest for today. Thank you.
Right, thank you, Penny. That's really, really useful. And thanks for taking us through that kind of really, you know, real clarity. So we have some sort of starter questions, but you might have your own questions as well. So we are going to maybe just think about, you know, is the diagram understandable? Does it make sense? Does it kind of show how things might work differently going forward? And what other information kind of would be helpful? What are the things you need to think that would be really included in that as well? So we are going to take down the slides so we can all see each other, because that's the kind of the aim of today, is really kind of have that kind of discussion, that sort of consultation around this as well. We also have a few people around the room that are involved very much in terms of this model design as well. You can see Oliver's here as the clinical director from the trust as well. And there'll be other people on the calls as well. So Penny and I will be able to take some of those questions, but there might be other people that are actually much better placed to respond to your question. So how's that landed for you from that presentation today? Thoughts? Don't be shy. Is it helpful to see that as a visual? Is there anything you think that should be kind of included in that would be sort of helpful? I think we kind of want to get to a point when we can kind of share this information and share the diagram, and everybody could take it back to their teams, and with quite kind of, you know, with a bit of support around text, as Penny mentioned, being able to kind of present that to their colleagues to explain, and then from that point on, when people start to come in, when the changes start to happen, because we're really in the design phase at the moment, then we'll go to the planning, and then we're going to sort of implementation and sort of delivery as well, that, you know, people will feel comfortable and, you know, confident in this kind of new way of working. So when they're actually doing that kind of day-to-day kind of meetings, people are kind of wishing to access support, they feel kind of, you know, able and kind of well equipped to explain it and to make sure that they're really supportive of this new way of working as well. I can't see.
We've got a couple of people with their hands up, Martin.
Oh, sorry, just come. All right, I didn't see them. Do you want to call them out? Is that right?
Yeah, sure. So Kathleen, do you want to go?
Sure. I'm actually planning to take the diagram to a team meeting tomorrow and get some feedback, so that would be good too. I guess my first thing that I want to say is that I think it looks really great. It's a great platform to start talking about things from, and all the changes seem very needed and make a lot of sense to me. I think on initial feedback, and this might be really different for other people, but when I first look at the diagram, I think of it as like a dartboard, or like it looks like a bit like a bullseye to me. And my only consideration is in terms of that, having the middle circle be getting more help, or the ATS or specialised support, I worry that that might make people think that's the support that I want and I'm looking for, and that's kind of what I'm aiming for. And I know people, and probably myself, have some prejudice around kind of self-help and advice already. So kind of thinking that you're aiming for the specialist, like really good gold standard support, and then aiming out like actually getting advice. Like I wonder if there would be a way to switch that around and still have the advice be a bigger section, but have specialised support be around the edge, like in a thinner way. Or
No, I think we've kind of had similar feedback, which is really helpful. I think it's almost like, and then the way it's reading, you have to kind of go through different kind of hoops to get into that central thing, particularly, and that's not what we want to do. And we've tried squares, triangles, we've created shapes that we never knew existed before, really. But we were trying to use the Thrive model as well as sort of, I don't know if everybody's familiar with that. It's just that kind of, this is sort of a starting point, getting advice, getting help, getting more help. So we're trying to kind of unify it and use other kind of examples. But we really want to take their feedback, and that's probably. Well, some of the idea is actually with the designer might be able to describe it much better, but also we might actually think about putting some kind of audio with it as well. So you can actually take it back to Teams as another example, and then you can play the video. And then that could, if we can't quite get it right, because we're not designers and things, if we can, at least we can talk to the actual kind of presentation, and it can actually describe that. It's making sure that we really hit the right message. But thanks for that feedback; it's really helpful.
I don't envy the job. Thanks for working on it.
And just to add, it's really, really helpful feedback. And there's something about a comms issue around all the other services and how expert they are, and what else is there that I think people don't necessarily hear enough about. So working with voluntary sector colleagues, they work with people with very complex needs, offering really good social support. And I understand that people, when we describe things as specialist, it's not always helpful, because every bit of that ring has specialism. So that's really helpful for us to think about language and think about how we make sure equal value is placed on all of those things. It's just dependent on, as a person, where you might be at a particular time, as opposed to thinking that's the best thing I need. Because it's a really different culture for us, isn't it? Moving to a different space of really shared. So we could definitely share that with a designer. Thank you.
Yeah, and it is that idea that you come into a sort of, it is all specialists, as Kenny said, but you come into one team. So it's not about sort of, psychiatrist, could be a peer specialist, is just a specialist as a psychiatrist as well. So, but I think that's the cultural thing we really have to go through as well. We can do sort of processes and systems, but actually it's about culturally, how do people experience that, and how joined up we are, really, really, truly kind of joined up and integrated with each other as well.
Yeah, that was brilliant feedback. Thank you, Kathleen. So we've got Susanna and Julia. You've both got your hands up. Susanna, do you want to come in next?
Sorry, just going to lower my head. So I work for Care Sport West Sussex. I've been sort of following the transformation from the beginning, from the voluntary sector kind of point of view. A couple of things. Thank you very much. The presentations, I had to, likewise, like Kathleen, have to get my head around it. The first question is, this presentation, is it aimed at the professionals? Because if we are also including in here the experts by experience, I'm not feeling that they would feel included. So that's one comment, nothing negative. I think it's really good, but it's good to get our heads around it before we kind of open it out to people with serious mental health illnesses. Inclusion is a big thing, because a lot of those people that we support, carers of people with mental illnesses, and I hear the word digital a lot, and we know that they will not kind of access things digitally. And are the two pilot hub projects kind of part of that circular diagram as well, the Bognor and the Crawley, or is that again completely separate? Because that's kind of a different approach we had when we launched that to people in Crawley, which I attended. And also you mentioned the primary care network already has 27 GPs who have the services launched. Is there a list of those that are already working, and can that be shared with the rest of us? And thank you very much for your ongoing work. That's all my comments. Thank you.
Thank you. Yeah, I think if I pick up one around the images, Penny, maybe you can come in on some of the other things as well. But I think in terms of actually kind of what's the final item for external use, it is going to be different. I think we really aim to have that clear message. Actually, if we're doing personalized and kind of whole care, it needs to be built around individuals as well. We're just not smart enough, clever enough to actually do that at the moment as well. I think when we set up, we think we probably need about 5 or 6 different diagrams to explain different things, and then we're going to kind of work towards that really kind of holistic diagram that does describe this as well. You know, we've had images of people and being much more reflective about the communities that we serve. They were a bit distracting because they weren't kind of designed, they didn't kind of work, so we've taken them out as well. But it's very much in terms of reflecting our population needs and the communities as well. I think there's such huge work around digital. When you say digital, sometimes it means so much. It can mean so much to different people. And I think when we talk about digital, we need to always be mindful about people who don't access digitally as well. And that's why we're trying to move towards kind of having potentially within neighbourhoods that we have kind of wellbeing hubs as well. So that's an opportunity for people that don't want to use telephones, don't want to kind of go and look up information on the computer, that actually can go and speak to people directly. But then also we need to be thinking about kind of communities and peoples that aren't going to be the ones actually kind of proactively kind of moving towards sort of services and support. So what do we do in terms of taking that kind of support out to people that aren't currently engaged or aren't aware of those services as well? So there's some of the detail we will be going to get into as well. So I hope that's helpful on a couple of questions, but maybe if I could just pass over to around the Crawley question, because I know Penny was actually at the Crawley event as well. I think there's a recognition that sometimes the system, the Sussex-wide work, hasn't always kept pace with some of the local developments as well. And that's what we're really trying to do, to make sure that there are really much more joined up about what we're doing Sussex-wide, what we're doing locally. So there might be some occasions that things might look different, or you might hear different messages, but our intention is to kind of bring them together. But if it's okay to kind of hand that over to Penny.
Yes, I see my colleagues Amanda and Alicia on the call who organised and chaired that event, which was fantastic. There are lots of people there, but it was linked absolutely with the transformation, as Martin says, because, and as I was trying to explain at the beginning, if we started this again, we'd have a model right at the start and say, this is what we're going to do. But actually, it didn't quite work out that way for us. So we're kind of trying to keep pace with both of those things at the same time. So things like the Crawley event were absolutely the beginnings, well, not the beginnings, but part of those conversations in Crawley about how do you bring everything in Crawley together and work in a much more joined up and cohesive way. So that absolutely is part of the transformation. As similarly to work in Bognor or in any other the systems, work that's already starting to happen everywhere is thinking about how do we really start to bring organisations together to really act in a much more joined up and proactive way. And it's almost laying the foundations for change. Those individual areas like West Sussex, you mentioned Crawley and Bognor, which is really helpful, will do also kind of report into, if you like, for want of a better term, an integrated steering group. So a group where all of the 3 areas comes together and says, oh, we're here or we're there, or these are the gaps, and or these are the priority areas that we want to be working on. And absolutely right, Crawley is the early implementer, or wave 1, you might hear it called all sorts of different things, but focus of some of that first bit of work. In the early days, we really thought we might have to start everywhere in just one place, but actually it's become a bit of a combination. So there is a big focus on those wave 1 sites, so to speak, and there's 1 in East, 1 in West, and 1 in Brighton and Hove, or 3 in Brighton and Hove. But actually everywhere, little bits of work are starting to emerge, and our current, I guess, challenge but opportunity and a bit of excitement is just to really make sure we carry on wrapping around all of those and making sure there's enough local flavour to meet health inequalities, but also enough standardisation for it not to be a bit of a postcode lottery. So Sussex is really big, isn't it? So that's a bit of a challenge. In terms of the primary care network, so there's 27 of we've got 39, as I said, of those clusters of practices, and we do have a list of where they are at the moment and where they're about to emerge. And it's changing all the time as things get recruited into. So it's exciting, and I can definitely speak with colleagues outside the core about how we can make sure that information is available to people in the context of where they are, if that's helpful.
Thank you. It's great. Thank you.
Thanks, Penny. Julia, you've got your hand up. Would you like to come in next?
Yeah, hi there. Thanks for this. It's very helpful actually to be able to discuss some of it. I think I'll keep it as simple as I can. Some of the points, the diagram itself, the font is really quite difficult to read from a visual point of view. It's very small, certainly around the edges where you're saying you want to kind of draw a bit, attention to that key point of getting the initial advice for people. So I found it quite hard to read. And things like local authorities and GPs, they're not represented within it very easily. And these are the parts that people will go to as their first step in their thinking currently as to who are the key, sort of agencies that will need to be targeted. And I wonder how much GPs are on board with this as well in terms of their cultural shifting in a way, for want of a better question, really, because my role is triage, assessment and treatment service. I'm triage lead. So I'm also interested to hear about the workshop that took place yesterday. I wasn't aware of it. So to kind of, I'm very pro the model of transformation and the integrated care. So I don't want to be negative, but this is really fundamental to what we do in triage, is how we link through all these services. So, and there are big key players within that, local authority and GPs being fundamental, that are resistive or very stuck with their understanding of how things work, and we'll always go for that bullseye. That was a really good analogy in the beginning there, that always go for that bullseye into the centre, particularly when risk is the key function that people want to address, really. So
yeah, really helpful comments actually. Take feedback about the text as well. We'll work on that to make sure that is much clearer and much more readable from that point of view. I think working with the PCNs, working with GPs is in some ways one of the biggest cultural or the changes that we're trying to make as well. And it has been challenging on both sides, really, because I think we've come together, different language, different kind of ways of working, but both were kind of different demands and high pressure as well. I think there has been some success around that. We've got now the emotional wellbeing services set up in the 27 sites. So then people are actually kind of actually seeing the benefit, actually working much more closely together and realizing actually we're sharing pressure and we're kind of having more coordinated conversations. And there's actually kind of some emerging evidence that is actually reducing the number of referrals in certain areas into kind of the ATS, your kind of world of triage as well. And people are getting better services because often people get referred to somebody or to another service, which isn't actually appropriate. So it's actually, if we can change that, we all kind of win from that as well. I think we're really kind of happy to kind of welcome kind of Oliver is on the call today in terms of that kind of clinical leadership. And I know he's going to be taking some of that work kind of forward as well, because we know that we're still at early days of the PCNs and how we're going to work. Some of the roles we've got in there at the moment is intentionally supposed to be the starting point. We need more and more support and resource going into those GP surgeries around housing, employment as well. So we know we've got a long journey as well. But Penny, I don't know if you want to come in, and Oliver too, around some of that kind of work, because I know you're, and hopefully everybody will be involved in some of that triage kind of conversations that were only just started yesterday, I suppose, wasn't it?
Yeah, so apologies, Julia. It was a small group came together around triage, and it's just the beginning. So it was a bit of an overarching workshop, a bit of a stock take. Where are we? Where are we going next? Are we all okay? So I'm hoping in each of the areas that will be fed back anyway. Anyone's welcome to that group, and we've decided to meet again. So please do contact me if you don't hear anything about it. I'll be absolutely more than happy to share it with you, but I'm hoping it will be cascaded around for relevant folk, because triage is one of those key pieces of work, and it can't all sit in triage as it exists now. and we're thinking about a stepping stone. How do we start to support bringing people together, and then how do we really start to support very local decisions? And it'll be an iterative stage, and as you rightly point out, that's not easy, because that's a big culture change for all of us, including SPFT, around how we work, who we hold on to, how do we describe what we do, how easy it is. And I know I've had myself, when I've been working in assessment and triage, very challenging conversations with referrers about, actually, I don't want this person to go here, I want them to go there. All of those things will take time. And if I hand out, bring Oliver in, I know he's really started to have those conversations with some of our clinical directors in primary care networks, who also have relationship managers. It's a whole other kind of industry, so to speak, that we need to really connect in much more tightly with. And I think, as Martin said, we are starting to do that in places like Highwood, Lewis and Haven with the Foundry. Glenn's on the call. That feels more proactive now, and it feels like things are working much better. But we know we're not there everywhere. So again, it's about that iterative process. I don't know, Oliver, if you had more to add.
I don't have much more to add, but just to say, Julia, that you're quite right that these are very important partners to have round the table. I suppose what is happening at the moment is we've agreed on some key principles that seem very important in triage in particular. One is that we have to ensure that different skills are represented when we are making a decision about who's most able to help somebody. And that I think although at the moment we've got triage hubs, and so it's actually quite, it's a relatively straightforward to expand the representation in those hubs. At some point in time, if we are successful in really engaging our local partners and working at a neighbourhood level, we may well want to have triage conversations much more locally between referrer and provider. And what I mean by that is individual teams may want to take on more of those functions, because they will be able to make more meaningful decisions to both the referrer and the provider and the patient. Now, that is quite a long way away, and there's all sorts of different conversations and agreements that need to happen in order to achieve that sort of vision. So I've heard Penny say that it's an iterative process and it's not linear, because all sorts of things have to happen in order to get to that point in time. But I think the vision, seems to me, that we've signed up to is pretty much agreed, and I think that's really exciting, actually, because if we know where we want to get to, then I think that's half the battle, frankly.
Thanks, Oliver. That was brilliant. Thank you. We are running over time slightly, but I can see, Glenn, you've patiently had your hand up for a while. Did you want to come in just before we close the webinar?
Yeah, sure. I was going to ask a question that actually a number of you have since touched upon, because I had my hand up for a while, and you've all spoken a bit about the kind of social aspect of why a number of people get referred to us in the ATS is often, with increasingly with kind of housing issues and financial difficulties, and it was touched upon in the model that there could be some access to those services at an early stage. But I was just I was going to ask about what the vision is for that, because I think that help needs to be, humans at the end of the the patient contact, rather than kind of a digital solution. But I think you have since touched upon that is the ambition, and it will be important to have those partners on board throughout the various stages. So I think you've answered that is the ambition.
I think it's a really good point, though, because we often, it was mentioned a few times in the last week or so, isn't it, around this no wrong door. And I think Penny describes it to making sure that while that's a really good aspiration, to make sure that actually it's really accessible, we have to be clear actually what's behind that door and what is that offer as well. So the integrated working group is actually kind of the work that will be taken on from this Thursday, is to kind of making sure that we have a really good handle on that, Glenn, around what's the core offer. So in every one of these potential neighbourhoods, there is a similar offer, and it can include making sure housing, employment, debt advisors are there, and it's everybody. Everybody has the same opportunity to access the same information as well. But we need to make sure that we kind of work with commissioners really closely, because there may be sort of areas that actually there isn't that provision in there, or actually we might need to change how that's contracted. We might need to make sure that actually those teams of people, because they might sit sort of quite separately around money advice, have to come into the kind of the neighbourhood, they have to come into the wellbeing hub, so they're actually very present, they're actually working very closely with some of the clinical staff or some of the peer specialists as well, and the whole thing starts to kind of join up much more kind of consistently as well. So it is our aspiration, and I think that's a good reminder almost that, you know, we're very keen to come back into these kind of forums to update everybody, to say, actually, you know, we've taken your, you know, hopefully you can see that we've taken your feedback about some of the things you've raised already today, but also we've kind of got the next version, we've got the next kind of detail around how that's going to be taken forward as well. So, you know, we'll be speaking to Megan, who kind of leads the comms for this programme, about making sure that we're kind of regularly kind of booked in to have this kind of feedback as well, because it's really, really helpful for us.
Great,
but
thank you.
Thanks for your point there, Glenn.
And just before we finish, one of the things that feels really important is we just start to have these discussions. So everyone who joins these webinars is so valuable to work from wherever you're from, to start to really think about that ambition of really culturally thinking about how we move to see ourselves as a resource in localities. And we all start to have those conversations, and we all start to become joined up, because just that act in itself, we've seen some really good outcomes from. And I'll just quickly, before we go, use Glenn as another example, who stood up and said, I've got this particular pressure in this team and this is what's happening. And he said that in a space where there were a lot of other people and providers who all stood up and said, okay, how can we help? And that kind of was the start of that conversation about, could we offer something different while these people are waiting, or is there something better anyway at this point for some of those individuals? So the thing that I would really, really urge, I'm sure my colleagues would as well, is to start thinking about who's around you, who's in your local area, who do we need to make contact with, how exciting this might be for us if we can get to that point of that end state dream of having really good functional neighbourhood teams. So just really appreciate people starting to talk about it, bring questions back. There's the contact numbers and the email that will be in part of the presentation. So please do, with any questions, or if it's useful for us to come and speak to anyone, just give us a shout and we'll make sure we arrange that. So thank you.
Thanks so much, Penny. That was great. Thank you. I'm sorry that we've overrun a little bit, but I think it was a really good discussion and it had a really good flow. So yeah, thanks to everybody for joining us today. We will follow up with an email with the presentation slides, details of the next webinar that's on the 16th of August at midday, and a link to how you can share your feedback. And thanks to Penny and Martin for taking us through the slides today. Thanks, everyone.
Great to see everybody.
Thank you. Bye.